Well, we're going to get started because it's 8 o'clock Central Standard Time on the dot. I'm Dr. Rita McGuire. I'm one of the co-founders for Wakanna for Life, and we'll talk about who and what Wakanna is, as well as I'm the chief medical advisor for the company, and I'm an obstetrician gynecologist. Tonight, we're going to talk about CBD and depression. Tonight, I'm going to dedicate this presentation in honor of my very dear friend of over 30 years, my sorority sister on one of the most amazing sororities in the world, Alpha Kappa Alpha sorority. Uella, who you see pictured in the middle, unfortunately suffered from major depression and took her life July of 2017. So I will dedicate this presentation to my dear friend and sorority sister, Uella Montgomery. Unfortunately, many of you may know someone who has depression that has taken their life, or maybe you know someone who has depression and or anxiety, and right now is on multiple medications. And that's why I thought it was very important to talk about depression, anxiety, and really how CBD can be used to address these issues. What exactly is CBD? CBD stands for cannabidiol. And cannabidiol is the second most common cannabinoid found in the cannabis sativa ale plant. It's the most common cannabinoid found in the hemp plant. And unlike THC or delta-9 tetrahydrocannabinol or marijuana, as you may know it, CBD does not cause any mind-altering effects. So it doesn't give you the high, but it does give you the medicinal benefits as THC does. I've been using CBD, cannabidiol, in my practice for the last 2.5 years. I use it in conjunction with other forms of therapy. And there's research that shows that CBD and CBD products, CBD oils, gummies may improve the symptoms associated with depression. So let's look at this plant. Cannabis has 2 species. And the 2 species is one on the left you see is hemp, which contains a high level of CBD and very minute or trace levels of THC, 0.3% or less of THC. Species 2, on the other hand, is marijuana. It contains a low level of CBD, and it contains more than 20% of THC. That's the part, the cannabinoid, that gives you the high, the THC. You can see by this diagram that CBD can be extracted from both hemp and marijuana. But tonight we're going to concentrate on the CBD that's extracted from hemp, which is the legal way that CBD is sold, consumed, extracted, and processed in the United States, outside of going to a medical marijuana dispensary or a recreational dispensary that many times extracts their CBD from marijuana. So we're going to be talking about CBD extracted from the industrial hemp plant, which contains less than 0.3% of THC. Well, when we look at the plant, the whole plant, we know that there are over 80 plus, some literature says 100 plus cannabinoids that the plant makes. But tonight we're going to concentrate on CBD, a little on delta-9 THC, and the other cannabinoids of interest. So as you can see in this diagram, CBD is the hero, right? It has a long list of medicinal properties. CBD is antibacterial, it inhibits cancer cell growth, it's neuroprotective, it promotes bone growth, it reduces seizures and convulsions, and we saw that with Charlotte Webb, When the little girl, Charlotte Fiji's parents introduced her to CBD, and her seizure, Dravet syndrome disorder, went from her having 300 seizures a week to 3 seizures a week. CBD also reduces blood sugar levels. It's an anti-diabetic. It reduces the function in the immune system. So it helps with disorders like lupus and fibromyalgia. It reduces inflammation. We talked about inflammation a week back, or maybe 2 weeks ago. We talked about arthritis. We also talked about heart disease. So it reduces the risk of arterial blockage that we see in coronary artery disease. It reduces small intestinal contractions. We talked about that, I think, a week ago. We talked about GI disorders. It reduces vomiting and nausea, very important in people who are on chemotherapy. It relieves pain and it relieves anxiety. It slows bacterial growth. It suppresses muscle spasms, important in those who have multiple sclerosis. It's tranquilizing. It treats skin disorders like psoriasis, eczema, and acne. It's also a vasorelaxant, so it helps to dilate vessels, blood vessels in the heart, dilate blood vessels in all organs of our body. So when we look at delta-9 THC, remember that is the cannabinoid that causes the mind high. It also has medicinal properties. It reduces vomiting and nausea, it relieves pain, it stimulates the appetite. That's really important in those who are undergoing chemotherapy, those who may be HIV/AIDS positive, and those who may be anorexic. It suppresses muscle spasms. But there are other cannabinoids that we look for when we look at a full spectrum product that we'll talk about later that are important in aiding medicinally. Like CBG, it aids in sleep. And we know when we talk further about depression and anxiety, that's one thing that we cannot get is sleep because we are anxious or we're depressed. CBG also inhibits cancer cell growth. It promotes bone growth. It slows bacterial growth. Let's look at CBC, another important cannabinoid. It also inhibits cancer cell growth, promotes bone growth, reduces inflammation, and relieves pain. So you can see by this full spectrum cannabinoid wheel that a full spectrum product actually enhances the benefits on a cellular level when we're talking about reducing and resolving symptoms that we're targeting in our life that may include symptoms, disorders like depression, like anxiety, like hypertension, diabetes, autoimmune diseases, convulsions, seizures, bacterial infections, multiple sclerosis. The list goes on and on and on about how these cannabinoids benefit the body. But how exactly does that happen? Well, CBD and CBN and THC and the other cannabinoids that you saw in that wheel work by the human endocannabinoid system. See, this system, every single person has and possess. This system is apparent and found in all vertebrae. And this system is the most vital regulatory system which impacts the physiological processes that affect pain, memory, appetite, inflammation, anxiety, depression, our immune system. So this system is made up of receptors, and you see the receptors on the right side, but actually there are receptors found throughout the entire body. These receptors are found primarily on the brain, the central nervous system, the immune system, the periphery, and about 10 different organs and glands, including the eyes, the heart, the lung, the liver, the intestine, the skin, the teeth. So this system is looking for cannabinoids to keep the body in balance. This system, the endocannabinoid system, is looking for cannabinoids to improve the serotonin and dopamine hormonal chemicals in the brain to improve mood, to improve our sleep, to decrease anxiety and depression. This system is looking for cannabinoids like THC and CBD and CBN to reduce inflammation and pain. Because many times when you are in pain, you are depressed. And when you are depressed and anxious because of this pain that you cannot control, you can't sleep. So all of this is full circle on how this system is looking for cannabinoids to put the body in balance. And it does that by the endocannabinoid system. So now let's move on to depression, because now you know a little about CBD, cannabidiol, a little bit about THC and the other cannabinoids that the plant makes. And now you know how it works in our body by the endocannabinoid. So a few statistics on depression. Major depressive disorder is a common psychiatric illness, affects about 5 to 30% of the population. In fact, according to a report in 2017 by the National Center for Health Statistics, almost 13% of Americans aged 12 and older take what? An antidepressant drug. These are drugs that work by acting on specific brain chemicals, serotonin, dopamine, that are involved in regulating mood. In fact, they found that the antidepressant use, these drugs increased by 65% between 1999 and 2014. Women are nearly twice as likely as men to be taking antidepressants. In fact, they were used 16.5% by females compared to just under 9% of males. So females, we truly have a increased predisposition in depression and the use of antidepressants. So some types of depression that you may or may not know about is seasonal affective depression. This occurs in climates where there is less sunlight at certain times of year. In fact, I have a colleague that moved to Florida because of this. Just the weather in the Midwest causes seasonal affective depression in her. There's also something that I deal with all the time as an obstetrician gynecologist, and that's postpartum depression. That is a more severe form of postpartum blues, where a woman will experience anhedonia, lack of bonding, lack of any sort of joy in her newborn, 6 or more weeks postpartum after having a baby. We have depression in children, we know about major depression, persistent depressive disorder, bipolar disorder, which is a combination of mania, manic, and depression together. Psychotic depression, where you're hearing and seeing things, and premenstrual dysphoric disorder, which is really, really severe in my patient population, where women who are premenstrual before their periods have a very major depressive symptoms that occur. And then situational depression that occurs when different life-changing or life-altering events happen in our life, like a loss of a loved one, or a loss of a job, or a loss of a relationship, a loss of a marriage. Some causes of depression. Well, we're not really sure what causes depression, but there is a theory that there's an altered brain structure and chemical function that occurs. What we find is that the circuits in the brain that regulate mood may work less efficiently during depression. And what we see, again, are levels of serotonin and dopamine. These are chemicals that are important that regulate our mood, they regulate our sleep. They become very low and they become inefficient in helping us to improve our mood. So drugs that treat depression are believed to improve the communication between these nerve cells to make them run more efficiently. Again, depression is thought to have a genetic predisposition. A lot of times you will see in families that there may be a family history in depression, anxiety. So many of those people are biologically prone to develop the disorder. And sometimes all they need, like my sorority sister, all they need is a stressor in their life to kick them over the edge into a major depressive symptoms. So what are some of the physical symptoms that we see when one is depressed? Well, we all feel down and sad or upset from time to time, but it becomes a concern when this happens for several weeks on end. You may see symptoms physically of decreased energy, chronic fatigue, or feeling sluggish, difficulty concentrating or making decisions or recalling information. Some people will develop physical symptoms, pains, aches, cramps, GI upset without any clear cause. There may be changes in appetite or weight. Some people will eat excessively and gain weight, and some people will have a loss of appetite and lose weight. There may be difficulty sleeping, waking early or oversleeping. Again, we talked about those very important chemicals that the brain makes that regulate sleep and mood, dopamine and serotonin. Some emotional symptoms that you see in those who are depressed: loss of interest or no longer finding pleasure in activities or hobbies. That's called anhedonia. That means that you may be someone that loves to roller skate. Every Saturday you're at the roller skating rink. But when you're depressed, you find that even things that bring you joy and bring you pleasure, you just have no interest in doing. There may be persistent feelings of sadness, anxiety, or emptiness, feeling hopeless or pessimistic. You may be experiencing a lot of irritability or restlessness or anger, or even feeling guilty or experiencing feelings of worthlessness or helplessness. There could be thoughts of death or suicide. If that occurs, there are suicide hotlines or there are talk lines. It's really important that if you have a plan to commit suicide, that you call these hotlines or you go to the nearest emergency room for immediate treatment. Here is a PET scan of a brain that shows different activity levels in a person with depression compared to a person without depression. And you can see the not depressed area is lit up and is very active. You know that those chemical compounds, serotonin and dopamine, are causing that PET scan to be very bright. Whereas in the depressed, those chemical levels are decreased, and so there is very little uptake within the brain in depressed people. So let's move on to some anxiety disorders. Well, top one that you may have experienced in your lifetime is a panic disorder. You may feel terror that strikes at a random time and during a panic attack. These people may have sweats, they may have chest pain, they even may feel palpitations where their heart is racing. There's also another anxiety disorder called social anxiety disorder. It's also called social phobia. This is when you feel overwhelmingly worried or self-conscious about everyday social situations. You may not go around a lot of people because you may become fearful or even embarrassed. You feel like you may be ridiculed. And then there's phobias. That's when you have an intense fear of a specific object or situation, a spider, a plane, a closed-in area. You may be one that can't do CAT scans or MRIs. You may have a fear of heights or flying. So the fear goes beyond what's appropriate and may cause you to avoid ordinary situations. And then there's generalized anxiety disorder. You feel excessive, unrealistic worry and tension with little or no reason at all. So some of the physical symptoms and behavioral changes that are caused by anxiety, again, kind of similar to depression, right? Feeling fatigued easily, difficulty concentrating or recalling things. You may have a lot of muscle tension, tension in your neck, in your back, in your shoulders. You may have a racing heartbeat, grinding teeth that may happen at night when you wake up in the morning, your jaws are sore. Again, sleep difficulties, including problems falling asleep, you're restless, or you just wake up unsatisfied that you got enough sleep. And then some of the emotional symptoms, again, very similar to depression, is the restlessness, irritability, you're feeling on edge, difficulty in controlling worry or fear, the feel of dread, and then that panic. Again, there are other emotional symptoms, as you can see here, even having trouble breathing, lots of headaches, again, avoiding things, sweating, stomach issues. All of these emotional and physical symptoms are very real. So how do you get a clinical diagnosis? Well, in medicine, we don't have a single test that can diagnose depression or anxiety. We will do a physical exam. We have depression and anxiety screening tests. Your doctor may even check your thyroid level, your vitamin level, and even hormonal levels. And then there may be a referral to a mental health expert, such as a psychiatrist or a psychologist. And then there's many, many medications that we use in healthcare for depression. One class of antidepressants are called SSRIs. Those are selective serotonin reuptake inhibitors. Those medications include Prozac, Zoloft, Lexapro, and Paxil and Celexa. I'm sure you've heard of many of these medications if you watch many of the commercials. And then there's something called serotonin norepinephrine reuptake inhibitors. Those examples are Effexor and Cymbalta. Each one of these medications carry unique benefits and risk. And then there's also anti-anxiety medications and mood stabilizers as well. But the biggest thing, these medications have some pretty serious side effects. One being sexual dysfunction. Can you imagine that? Being depressed and then following that, sexual dysfunction in your libido, erectile dysfunction. A lot of GI upset can occur from these medications, like nausea and diarrhea. Dry mouth is a big problem, as well as dizziness and headaches. So these medications don't come with any very low-level side effects. Prozac, unfortunately, one of its side effects is suicidal ideations. That medication can cause one to think about and act out suicide. Then there's other therapies that we use for depression. There's something called cognitive behavioral therapy. That's when you'll learn how to adjust your thoughts, your behaviors, and your reactions to be more rational. There's interpersonal therapy. This type focuses on learning how to communicate more effectively and help to express yourself better. And then there's problem-solving therapy. This therapy focuses on using coping skills to manage symptoms. A slide that's missing is some holistic therapies in addressing depression and anxiety. Those holistic methods, again, are diet. I'm really big on diet, taking a lot of the processed food, fried food, fast food away. Exercise. We know that exercise can help manage stress and anxiety and depression. Well, how does it do that? Well, there are studies that show that the body actually produces cannabinoids called endocannabinoids when you exercise. Those endocannabinoids help reduce depression and anxiety. There's yoga, there's swimming, there's meditation, there's prayer. There are herbal remedies like St. John worts, and then there's CBD. CBD can help with depression and anxiety. Well, how does it do that? Well, there's research that shows that it lowers anxiety. And we talked about CBD when we looked at that wheel, right? We saw that it has anti-anxiety properties. It helps to improve your cognitive impairment. It decreases anxiety and even fear of public speaking. But more importantly, we'll talk later that it works on the serotonin and dopamine pathways, not to increase those hormones in the brain and central nervous system, but again, through the endocannabinoid system, it helps to put the body and those hormones in balance so that the body can use the serotonin and dopamine that our body is already producing. In addition to, CBD can address and relieve chronic pain. And we know that many people who have chronic pain are depressed. They're very anxious because their quality of life has been diminished because of their pain. So some research on CBD and depression. There are several studies that I'll share with you that show that CBD can benefit those with depression because of its positive effect on the serotonin receptors. So those serotonin receptors, again, are found in the brain and the central nervous system to help improve mood. In fact, there was a study in 2014. This study was conducted on animals, but it found that CBD's impact on the brain produced an antidepressant and an anti-anxiety effect. There was another study in 2018 that reviewed the existing CBD studies and showed again that this cannabinoid has anti-stress effects, which actually help reduce depression. And then there was a study in 2019, just recently, that found that CBD actually works faster than antidepressant medication. Remember, antidepressant medication takes about 6 to 8 weeks to even kick in. Unlike CBD, where we're seeing so many testimonies that CBD can take within 24 to 48 hours to help people sleep, to help people relieve their pain, and to help people relieve depression and anxiety effects. So improving insomnia, improving sexual dysfunction, improving mood swings, and improving the overall health in those who are depressed. Anxiety, again, there were studies that showed that CBD can work not only on those who are depressed, but those who are anxious. This study showed that using 300 milligrams of CBD was given to a control of patients that had to speak in front of a large crowd, and it showed that it decreased their anxiety level. There was another study that they used CBD for those who had generalized social anxiety disorder. They were given 600 milligrams of CBD before a public speech, and it demonstrated that their anxiety markers went significantly down. Again, CBD does have some minor side effects, but nothing like the side effects that antidepressant medications have. In fact, in 2017, there was a review conducted by the World Health Organization, and they found that CBD was generally safe and very well tolerated by most people. Some minor effects that were reported by researchers include diarrhea, some fatigue, and changes in weight or appetite. But overall, CBD is well tolerated and has very little side effects. So are you interested in trying CBD for depression or anxiety? Hopefully you are. We're going to talk about this specifically with products, but CBD, again, is cannabidiol, and it's a natural substance that may help relieve symptoms of anxiety, symptoms of depression. If you have PTSD, generalized anxiety, social anxiety, CBD absolutely may be useful as part of your treatment plan. And we're going to move into now, who is Wakanna, our product line, and a little bit on how we can use CBD for depression and anxiety. So Wakanna is the company, and our company was launched on April 20th of 2019. Wakanna was brought into existence through the synergistic efforts and shared foundational values of 4 African American women who believe that health, wealth, legacy, and freedom are gifts that belong to all people. The 4 co-founders are here. Melissa Boston is our CEO. She brings over 29 years of experience in the direct selling industry and more than 15 years in business development, sales, and collections. She has been MVP of 6 out of the 8 companies, corporate America companies that she has worked for full time. In fact, she retired at the age of 32. She's also a social media strategist and top performer in the direct selling industry. She's built and coached more than 50,000 distributors in over 40 countries. Dr. Patricia Van Pelt is our president. She is a state senator here in Illinois, serving her 3rd term. She's an evangelist, she's an author, she's an entrepreneur and overcomer. She is truly a seasoned business owner. In fact, has brought our pathway to ownership, where you can own a piece of Wakanna, to our business model. Phyllis Nash is our Senior VP of Sales. She is an entrepreneur. She has also owned and developed many businesses in the liquor industry, in the restaurant industry, as well as in real estate. She is our midwife of Wakanna. And then myself, Dr. Rita McGuire, I'm the Chief Medical Officer. I bring over 30 years in the healthcare industry as an obstetrician gynecologist, and have been in this cannabis space, as all 4 of us have in the last 3 years, truly have been all over the world, helping not only healthcare professionals, but communities to understand the power of the medicinal part of this plant. I was also very instrumental in the passage of the adult use law here in Illinois, and excited to bring to you, again, our products at Wakanna that can address symptoms that we find in those who suffer from depression and anxiety. Well, this is our product line, our Wakanna Power and our Wakanna Pure. Our Wakanna Power products are products that have the legal limit of THC, which is 0.3%. Our Power line is a full spectrum line. That means we use the whole plant and the cannabinoids and flavonoids and terpenes in our CBD products. And then we have our Pure line, which is our broad spectrum line. That line uses less than 0.0% of THC. That Pure line is a great line for those who have random drug screens at their job. Our products are products you can trust. You can agree with me that there's CBD products everywhere. There's CBD products everywhere, but not all CBD products are made equally, right? There's CBD at the gas station. There's CBD at the smoke shops. There's CBD at the beauty shop. But I wouldn't trust those products. Why? Because our products are compliant with the State Department of Agriculture. We use some of the most rich medicinal hemp that is fully compliant with the State Department of Agriculture regulations. Our products are sourced from farms in Oregon, Kentucky, and Colorado. Our products are industrial hemp registered, and our products are Farm Bill compliant. In 2018, President Trump passed the Farm Bill, the 2018 Farm Bill. That bill allowed hemp to no longer be a Schedule I drug, so it was descheduled. Hemp now is legal on a federal level in all 50 states to be sold, consumed, and cultivated. This bill also states that CBD, to be compliant, has to come from industrial hemp, and it has to contain the legal limit, which is 0.3% or less of THC. Our products are double certified, they're third-party validated. That is truly very important. That means before our products hit your shelf, they have been tested in an ISO lab that tests for mold, mildew, heavy metals, pesticides, and it also tests for the cannabinoid profile to ensure that there is CBD, the legal amount of THC, and the other terpenes that we're looking for in a full spectrum and then a broad spectrum product. So at this point, I always stop sharing my screen so that we can talk about some products, okay? So tonight, we're going to start with our power line. Our first product is our Powered by Hempranium. This is a product that is a tincture, and a tincture means that you use the product underneath your tongue, and this product is a product that can be used by someone who is suffering from depression and anxiety. Again, CBD has anti-anxiety, it has anti-anxiolytic, as well as properties that address the serotonin and dopamine pathways in the brain to help you sleep, to help you face anxiety-provoking situations like maybe speaking in front of a room, or maybe addressing a task like a presentation or even a test. This is a 500 milligram concentration in a 15 ml bottle. The recommended dosing is 3 drops in the morning and 3 drops in the evening. Whenever you're introducing CBD into the body, it's very important to start low and to start slow. More is not better. In fact, the Mayo Clinic did a study, and what they found is that people who have chronic conditions don't need any more than 20 to 25 milligrams of CBD on a daily dose. Now, after 4 days, I always recommend to my patients to increase the dose, double the dose if you're not getting the symptoms resolved that you're looking for or you're targeting. Again, 3 drops in the morning, 3 drops in the evening. You can increase that to 6 drops in the morning, 6 drops in the evening, and the maximum dose that most people may need is 15 drops in the morning, 15 drops in the evening. Our second power product is our water soluble, and you'll see the blue labeling on that. Everything is color coded so that you can figure out which product is right for you. I love the water soluble. Why? Because I have my tea here. I was a little anxious before this presentation. I put 3 drops in my tea, and voila, you have a CBD product that you can infuse in your beverages, in your food, in your sauces, in your juice, in your smoothies, etc. 3 drops in the morning, 3 drops in the evening is a great way to start. We even have a power product that is a culinary plus. This is a product that you can add to your cookies, your brownies, your your sauce. You may be, for 4th of July, for example, I added this to my barbecue sauce. You can cook with it, you can bake with it, or you can use this as a tincture, which means you can put it underneath your tongue. And again, I failed to mention that the Hempranium Power has additional certified organic essential oils like black seed, turmeric, and peppermint that give it taste. Well, the Culinary Plus CBD Power does not have those essential oils added. Why? Because you don't want those taste in your brownies or cookies. So this is a great product that is unflavored that you can use as a tincture underneath the tongue, or you can use it in your baked goods. Our other power product is our vape cartridges. Now, our vape cartridges are amazing. You've heard a lot about vapes in the news. Unfortunately, I think we've had 13 deaths from people vaping, but they're not vaping Wakanna products. What they are vaping are off black market cartridges. Black market means you go around the corner or you go down the street and you buy a cartridge from an unknown source. Unknown source. That means that source has added things like rat poison and opioids and vitamin E as the carrier oil, nicotine, a lot of fillers that has been very, very toxic, not only to the lung, but to the entire body. And we've had several people that die. Well, our cartridges are sealed. You can't open them. You can't tamper with them. And they're filled of CBD, that is an organic CBD product that is sourced, double certified, third-party validated, and is a very safe way to address symptoms of depression and anxiety. Why? Because vaping's onset of action is within 1 to 5 minutes. Within 1 to 5 minutes of a panic attack or an anxiety or depression, or maybe you're tossing and turning because you're anxious or you can't sleep, 1 to 3 puffs from our vape cartridges can address those issues. That's why I love vaping, because the onset of action is within 1 to 5 minutes. Now, I failed to mention the onset of action of our CBD oil tinctures and water solubles are about 15 to 20 minutes before they get into the bloodstream. So just so you know that they take a little longer than a vape cartridge. Highly recommend vaping. Our other line is our Pure line. Our Pure line is our water soluble. This again can be added to your tea, your coffee, your smoothies, your juices, your cocktails, your mocktails. This again is a great product that has a white label, which means it's a broad spectrum product. That means that it contains less than 0.0% of THC. Again, a great product for those who have random drug screens at their job and want to have relief from depression and anxiety with our water soluble product. We also have our gummies here. I'm going to switch back to my shared screen because I can't find my gummies here. Let's switch back to the shared screen. Well, let's finish off with our tinctures first. We have our Power MD. Our Powered MD is powered by Hempranium. This is our most concentrated formulation that we have at Wakanna. It's 750 milligrams in a 15 ml bottle. This concentration is great for those who have a more severe condition when we're talking about depression and anxiety. It is giving you 2.5 milligrams of each drop of CBD. Again, 3 drops is where I always start. 3 drops in the morning, 3 drops in the evening will give you 15 milligrams of CBD. Now, this product is different because the phenotypic makeup of this industrial hemp plant is a shorter, fatter plant. So phenotypically, this product will yield a higher percentage of cannabinoids like CBD, CBN, CBG, and delta-9 of THC. Many physician offices love this product, as well as pharmacies are bringing on this product as well. It's a great way, again, to enhance The CBD, we've enhanced it with a proprietary formulation, which includes peppermint, black seed, and turmeric. I'm going to go now to our topical products. Again, depression and anxiety can come from lots of people who have pain. We here at Wakanna have two topical products that are amazing that address inflammation and pain. This is our Power Extreme Relief, which is a 200 milligram in a 15 ml jar, which also has a proprietary blend of essential oils that contain turmeric, black seed, arnica, eucalyptus, menthol crystals, peppermint. This formulation has about 9 essential oils with the CBD that address inflammation and pain. Again, topicals do not pass the blood-brain barrier, so even though this contains 0.3% or less of THC, this is still a product you can use if you have random drug screens in your job. Our other Power Relief is a 500 milligram in a 60 ml jar. Again, this is a great product to offer fast relief to an area that's causing inflammation or pain. Inflammation or pain, again, can cause depression, which can cause insomnia. So it's just a vicious circle. Again, this is a great product that can be used with our tinctures, with our vape cartridges, with our gummies as well to help relieve depression and anxiety. So this is one product that I just want to talk about. These are our gummies are broad spectrum, which is our pure line, and our power line, which is our full spectrum line. Each gummy is vegan, it's non-GMO, and each one of our gummies, either pure or power line, contains 25 milligrams of CBD. Again, these gummies are a great way for those who suffer from depression or anxiety to help them sleep at night. One gummy at night is a great way to get that restorative REM sleep that helps to decrease inflammation, to decrease anxiety and depression. Our gummies are infused. That's really important. They're not coated. The CBD is infused within the gummy. That really helps it to be much more potent and efficient when you're taking the gummy. So I'm going to share my screen one last time to show you my last slides. And that's really how to get started in getting these products in your hand. Well, one way is getting our personal use dispensary. Our personal use dispensary is a great way to get a variety of our products, some of our tinctures, some of our water solubles, our Culinary Plus, our vape cartridges, and our gummies. This personal use dispensary is $299. And what you're doing when you come in with the personal use dispensary is you're buying it at wholesale. So you're getting about a 40% savings. You're also able to have an online website as well when you come in with this personal use dispensary. So it's a great way to get started on products, as well as sharing these products with friends and family through your online site. Through that online site, you get an extra bonus in actually earning commissions when your friends and family and coworkers purchase products from your online site. We also give you a master key. That's the ability to give away as many online sites as you like, or online dispensaries as you like, for 30 days. What happens after day 30? Well, those online sites that you've given away and that online site you have, those commissions are going to be held until you do something called Become Certified. Here at Wakanna, we are big on education. You know, every Wednesday night, I'm educating our dispensary owners on our product line, as well as different conditions that these products can be used for. So we have something called a Wakanna University that we want to invite you after day 30 to become certified so that you can continue to learn and to continue to be an expert on CBD. Now, our full crown jewel dispensary is another way in getting these products to you. This is a 50% profit margin where you're purchasing a full line dispensary. That means you get 3 of those personal dispensaries, and you get a toolbox that includes our Wakanna University basic certification vouchers. You get that broker master key, and that's a $2,000 value. This is a great way to not only start the products for yourself, but you're actually starting a business with Wakanna. You're actually starting a business in the next, what I call, trillion-dollar industry of cannabis. This is a great way to learn how to infuse products, to have dinners, and to really explore on using these products in other ways than just tinctures. That means having a CBD infused dinner, or a CBD infused cocktail party, or a CBD wine tasting party, or even starting to bake and cook for the holidays with CBD. And we know what the holiday brings, right? The holiday brings a lot of depression and anxiety for a lot of people. So that is another way that you can get started with the business. And then another way would be just to individually purchase products from the person that invited you on the line. That person who invited you on the line absolutely loves you. That person may know someone that you may know that you can help that may have depression or anxiety, that can use a holistic way of addressing depression and anxiety, an organic way of addressing depression and anxiety, and that's with our CBD products, be it through our vape oil cartridges or our gummies or our water solubles, our tinctures, or even baking and cooking with our CBD products. So again, we want to thank you for joining us tonight. I'm going to open it up and share with you some questions that some of you may have. You can put those questions in the chat box. There is a chat box that you see. It may be to the right of you, or you can put it in the Q&A box here. Those questions can be typed in. And you can type your questions right in the chat box. We have about 7 minutes for your questions. Someone has a questions about diabetes. What is your question about diabetes? So the question about diabetes is, how does CBD lower glucose levels? Well, it does it in several different ways. CBD is an anti-diabetic properties. It also has anti-inflammatory properties, and we know that in diabetes, there's inflammation of the beta cells of the pancreas. It also causes the insulin resistance that we see in type 1 and type 2 diabetes to be addressed. So CBD goes in, lowers the inflammation around the beta cells. Our CBD oil also is enhanced with black seed. Black seed also helps to rebuild the beta cells of the pancreas. So the combination of decreasing inflammation, the combination of rebuilding the beta cells of the pancreas, as well as improving the insulin resistance that we see in diabetics. Overall, CBD improves glucose levels. Along with that, again, improving your diet. Along with that, exercising in combination with the CBD and the black seed that's in our formulation, our hempranium formulation. I've seen in my practice, a lot of patients been able to decrease their metformin. They've been able to decrease their insulin intake, and they've truly been very happy in CBD and how it's holistically helping them to improve their diabetes. But again, you have to work with CBD. You can't continue to have the same diet that's high in those carbs, that's high in processed sugars, to think that CBD is an all magical product. The combination of improving your diet, improving your exercise, truly I've seen in my patients, in my practice, improve their overall hemoglobin A1C levels, as well as their fasting blood glucose levels. What percentage of CBD or cannabidiol or CBDA contained in the company's products? Our products contain between 4 and 20% in our cannabinoid profile. Our Hempranium MD, again, has a higher percentage. Our Hempranium MD has about 55 milligrams per ml in that product, so it has a higher level cannabinoid profile. What is the best way to use CBD for dialysis patients with lupus? Well, those patients absolutely with dialysis and lupus absolutely has to get cleared by their physician to take CBD or any nutraceutical product, because we don't know and we are not in the position to be anyone's physician. So anyone that's on multiple medications, they're on dialysis, they're under a physician's care, they should get their physician's okay before starting CBD. Does the company list its products for quality and make results? Yes. So we have certificates of analysis that we're in the process of putting on our website. We're hoping that all of those COAs will be on the website by next week. During our certification in our Wakanna University, in our compliance section, I already shared many of the COAs with those who are brokers and distributors with Wakanna. So they are all available and they will soon be on our website. That is very important that we are already ahead of the game as it relates to the FDA. The FDA is going to regulate this industry. COA, certificates of analysis, clean rooms, GMP lab facilities, all of these things we have in place at Wakanna already. I'm very proud to be the Chief Medical Officer to ensure continued compliance in this unregulated industry that soon will be regulated. Is vaping, gummies too much to take in a day? So something is called microdosing. Microdosing is a great way to take a little bit of CBD at a time. Some people will take a little bit at a time in a different method of ingestion, i.e. some people may use a water soluble in their coffee in the morning or tea. Then they may turn around and use a tincture around lunchtime, and then they may do a gummy at night. So absolutely, it's important to understand when you first start taking CBD, more is not better. You want to take a little bit at a time initially. That's why I always teach, start low and start slow. Start with 3 drops in the morning, 3 drops in the evening to start to introduce CBD in the system. Then you can start to introduce as you see your symptoms being resolved or not resolved, to increase that dose. But absolutely, if you're dealing with a severe condition or a severe symptoms that may be due to depression or anxiety or even pain or insomnia, absolutely using a gummy at night is a great addition to what you're using during the day, which may be a tincture or a water soluble. After you become a distributor, do you get the products at a discount? No, all products are priced the same for distributors and customers, but you get the commission on every product that you purchase from the company as a distributor. You make between 20 and 50% commission. For gout, which is the best product to use? Well, all the products are best to be used for gout. Why? Because CBD, again, has anti-inflammatory properties. So it depends on you personally which route is best for you. So you may want to use a tincture. You may want to use a water soluble. You may want to bake with CBD. You may want to use gummies. You may want to use the topical product for gout. It depends on you and your method. You may want to vape for a flare gout. It depends on you and your method of ingestion, which is great for you. There are some people who have never ever smoked in their life. So obviously, why would they vape? That's not something that they want to do. That's not something they're used to doing. So they may want to go with using CBD and infusing it in their tea, their water, their smoothie. Our growers, cultivators are located in, our farms are located in Colorado. They're located in Kentucky and Oregon. Are the company's info made available? No, that's proprietary information. Those companies are not made available to the public. So we are 2 minutes over time. If you have additional questions, I want you to direct those questions to the person who invited you on the line. You can also reach me at Dr. Rita, R-I-T-A, Mac, M-A-C, at yahoo.com. I'm putting that in the group chat right now. That's Dr. Rita Mac at yahoo.com if you have any further questions. But obviously, whoever invited you on the line, you want to call them immediately so that you can get your questions further answered. You want to get your products ordered, and you want to become involved with Wakanna University, and you want to be in the position to take back your health, your wealth, legacy, and freedom. So make it an amazing rest of your evening. We will see you next Wednesday. Again, feel free to email me topics that you want to discuss next Wednesday. Thus far, we've talked about CBD and arthritis. We've talked about CBD and heart disease. We've covered CBD and GI issues like reflux and GERD. And tonight, we've discussed CBD as it relates to depression and anxiety. Thank you so much for joining me. We will see you all next Wednesday evening. I will place the recording of this webinar on Wakanna for Life Facebook page. So if you are not a part of our Facebook page, you want to ask to join Wakanna for Life. That's our Facebook page. But you want to contact the person that invited you so they can give you all the information about all of our calls and all of our events here locally in Texas and all over the 50 states that Wakanna is being a major, major player in. So good night, and we will see you all next